All right, we're going to talk about administering the nitrous sedation. When the flow meter is first turned on, it will default to 5 liters of flow. And since nitrous is not turned on, all that 5 liters is oxygen. Depending on the size of the patient, it's not unusual to need more than 5 liters. So a larger patient might need up to 15 liters of flow, and a smaller patient, but somewhere between 5 and 10. But it's probably a good idea to increase the flow to 10 liters per minute, and you can press the flush button to inflate the black inhalation bag. Just hold the mask up against a flat surface while you're doing this, just to inflate the bag quicker. Once the black inhalation bag is inflated, then you place the mask on the patient, starting with placing it underneath the chin first and then placing it across the bridge of the nose. It's important to instruct the patient on how to hold the mask, and so that it is held firmly onto their face. They have to press it against their face tightly enough that there are no gaps between the mask and their face. Once the mask is properly placed on the patient's face and the patient is holding it correctly, the patient is asked to take a big deep breath and exhale. If there is a good seal between the patient's face and the mask, then the green bag should inflate. The function of the green bag is to receive the patient's exhaled air, and also it functions to tell us of the quality of the seal between the patient's face and the mask. Once you're satisfied with the quality of the seal, then you turn on the nitrous. In a larger individual, you can start at 40%, smaller individual maybe start at 30%, and to adjust up or down depending on feedback from the patient. We teach the patients to use nonverbal communication, so a thumbs up for increasing, thumbs down for decreasing concentration, and the OK sign if they're happy with the concentration as it is. The total flow, which is the number on the right side of the flow meter, may have to be increased during parts of the procedure which are more stimulating, so as to maintain the black bag. So the right side of the flow meter is just to keep the black bag inflated. The maximum flow rate is 19 liters per minute. You could leave it at that, you just use more gas. So somewhere between 10 and 19 liters is usually standard. At the end of the procedure, the nitrous is turned down to 0 and the patient is allowed to breathe 100% oxygen for 3 to 5 minutes. And the whole idea of that is to flush out the nitrous in their lungs and replace it with the oxygen to wash out the nitrous in their body. And also it avoids something called diffusion hypoxia, which can happen particularly in severely emphysematous patients. And it's fairly easy to avoid so long as you administer 100% oxygen at the end of a procedure. After the 3 to 5 minutes of breathing 100% oxygen, the flow meter can be turned off and the mask can be removed. And the patient is asked if they're ready to sit up. Now we generally do this gradually because sometimes some patients can be lightheaded, and we let them sit for a few minutes, and then once they feel ready, then they can get up and walk to the bathroom or to a post-procedure room.